Okay, so my name's Logan. I'm a PA student. I'm going to be conducting your exam today. So first thing I'm going to do, I'm going to have you step over here to this piece of tape. We're going to start with a little visual assessment. So what I want you to do is you're just going to stand right there, actually right behind the tape. So right there, perfect. Okay, so what I want you to do is I want you to read me the lowest line that you can. So first thing I want you to do is I want you to cover one eye and read the lowest line that you can.
L E F O D P C T.
Good. Okay. So you're gonna close it with the other eye. Cover up the other eye. Do the same thing. What's the lowest line you can read?
L E F O P C T.
Perfect. And then both eyes open. What's the lowest one you can read?
L E F O P D. Wait. L E F O D P C T.
Perfect. Awesome. Good. You have to find your vision in both eyes.
Yeah.
Okay. So go ahead and sneak back over here. Okay, so the first thing I want you to do, I just want you to tell me if you can hear this. Okay?
Yes.
Can you hear that? Okay. How about this way?
Yes.
Yeah? Okay, perfect. Okay, so next thing I'm gonna do, I'm just gonna take a look at your eyes, make sure everything's looking good. Okay. No swelling, erythema, or any redness along the lids or eyelashes. No tearing or swelling on the lacrimal sac. I want you to take your eyes and go in a circle. Slowly. Okay, good. Sclera is normal in color, no signs of neovascularization, no masses or edema. Okay, good. So, I'm going to shine this light in your eye. It might be a little uncomfortable, but normal pupil response to light. Pupils are also normal in size. Alright, I'm going to shine this light over here a little bit. Okay. Good. Awesome. Normal cornea and lens. So next thing I'm going to do, I just want you to look at this light here, okay? Good. Normal corneal refraction. Next thing I want you to do, I want you to cover up one eye for me. Okay, good. And move here. Good. Do that on the other side. There we go. Perfect. Good accommodation on both eyes. So next thing we're gonna do, I'm gonna dim these lights a little bit, and we're gonna take a look at the back part of your eye. Okay? So we're going to turn all these lights down. The light doesn't work on this, but I'm just going to act as if it does. So I want you to just focus on any point on that wall back there. Okay? Same thing. Okay. Normal retina and normal optic disc. No signs of cupping on the optic disc. Retina is normal. No signs of any exudates, neovascularizations, hemorrhages, or anything like that. I'll turn these lights back on for right now. Okay. So next thing I want to do, we're going to look at some of your eye movements. So what I want you to do is I want you to just follow my pen. Okay? Awesome. Normal extraocular eye movements. There is one more thing I want you to do with your ears. Something else we're gonna do. I want you to cover up one ear so you can stick your finger in it, or you can hold it here. And I'm gonna whisper a word, and I want you to tell me what word you hear. Okay?
Okay. Pencil.
Do that with the other ear.
Extra.
Extra. Okay. Cool. Awesome. All right. Next thing I'm gonna do, I'm gonna feel your ears a little bit, just see if there's if any of this hurts, is tender, any pain or anything like that. Just let me know, okay? So I'm gonna do this with this ear first. Any issues?
Yep.
No, nothing. Okay. We're gonna come to this side, do the same thing. Any issues? Any tenderness, pain, anything like that? No, nothing. Awesome. No issues with the auricle tragus. No signs of mastoiditis. So next thing I'm gonna do, we're gonna look inside of your ear. Okay? Like I said again, if any of this hurts or anything like that, just let me know.
Okay.
Perfect. We're gonna come do this on the same thing on the other side. Okay, awesome. Ear canal appears normal. No signs of any inflammation, no impacted cerumen, no foreign bodies. Tympanic membrane is normal upon exam. Tympanic membrane has a pink gray color to it, as well as it's translucent, and you can see a part of the malleus inside of it as well. The next thing that I would do, I would attach the pneumatoscope here to the edge of this otoscope, and I would place it inside the ear canal and give a light push of air to assess mobility of the tympanic membrane while also not perforating the tympanic membrane. Okay? So, next thing I'm going to do, we're going to use this little tuning fork to assess if you hear anything, okay? So, first thing I'm going to do, I'm going to tap it, and I'm going to put it in the middle of your forehead. What I want you to tell me is, does the sound louder in one ear or the other, or does it feel like the sound is pushed fully in the middle? Okay.
It feels like it's in the middle.
It's in the middle? Okay, good. Normal Weber test. So, we're going to do the same kind of thing on each other side of the ear. So, I'm going to tap it once, and this is going to be the first thing you hear. We're going to stop. I'm going to tap it. I'm going to put it on the back of your head. You're going to tell me which one's louder. The first one or the second one? Okay. So that's one. Which is louder? One. Okay. And then let's see. Which one's louder?
One.
Okay. Normal Ryan test. Nose appears normal upon exam. No deformities, no swelling, no erythema. The next thing I want you to do, I want you to cover up one nostril at a time, and I want you to blow out of it. Okay, I'm gonna do the same thing with the other side. All right, normal patency on both sides. The next thing that I would do in this exam is I would place the nasal speculum inside each of the nair with a light to gain a view of the nasal mucosa, as well as gain view of the nasal turbinates. Okay. Next thing, what I want you to do, I literally just want you to look straight up to this guy. Look underneath. Okay. No deviated septum. Now, I'm going to feel around your nose, okay? I want you to tell me if anything hurts, sensitive, anything same thing around your forehead and then right here on your cheeks as well.
Okay.
Okay.
No pain.
No pain, no tenderness. Okay, good. No pain or tenderness within the frontal or maxillary sinuses. Okay, so the next and one of the last things we're going to do, lips appear normal upon exam, no signs of cyanosis, no lesions, no masses, no erythema. So, I'm going to have you open your mouth, really big and tall. I'm just going to take a look inside it, okay? So, open your mouth. Perfect. Okay. Perfect. Stick your tongue out and just say ah for me. Okay. Do it one more time. Good. Okay. No uvular deviation. Oral mucosa appears normal. No sores. No erythema. Hard palate on the top part of the oral cavity appears normal as well. Tongue appears normal in size. No swelling. No redness. And no signs of pharyngitis. No tonsillar exudates. And no pain. The last thing that I would do is to palpate the lower part of the oral cavity. I would first don on a pair of gloves, and then I would take a gauze, place it at the tip of the patient's tongue to hold it up. I would then have the patient move their tongue around so I can gain access to both sides of the bottom portion of the oral cavity. As the tongue is lifted up, I would go inside and palpate the lower part of the oral cavity in order to assess for any abnormalities, tenderness, pain, masses, anything like that. And then finally, I would palpate all of the teeth to assess for any tenderness, pain, loose teeth, or anything like that.